It's my pleasure to introduce you to our next speaker, George Morris. I've had the privilege of working alongside George, and I can tell you that his passion for leveraging technology to improve patient care is truly inspiring. George isn't just about fancy titles and impressive institutions, though he's got plenty of them under his belt. He's about making a real difference in people's lives. From UCLA to Harvard and Dartmouth to right here at Cook Children's, George has left a trail of technological breakthroughs and improved enterprise systems in his wake. But what really sets George apart is his ability to see the human side of technology. He understands that behind every data point is a patient, a family, a story. I've seen firsthand how George's innovative approach to electronic health records and data analytics is transforming the way we conduct research and deliver care here at Cook Children's. He has this unique ability to take complex technological concepts and translate them into practical solutions that benefit our young patients and their families. A research ally and partner, George's expertise in informatics and analytics has significantly moved the landscape of research architecture forward. Under his leadership, Cook Children's has made significant strides in leveraging technology to enhance patient care and research capabilities. He is at the forefront of addressing the challenges posed by electronic health records in clinical and research contexts. But don't let his impressive resume fool you. George is as down to earth as they come. He's always ready with a kind word and a helping hand. Today, we are fortunate to have George share his insights on how technology, data, and research intersect to shape the future of healthcare. So without further ado, please join me in giving a warm welcome to our friend and colleague, George Morris.
Great, thank you. Wow, that's a terrific intro. Thank you, Lori. I want to say thank you all for letting an IT guy speak at a research symposium. So thank you all. I'm fast approaching my third year anniversary here at Cook Children's, and I've actually moved to Fort Worth, and a number of colleagues have asked me to reflect on the 3 years that I've been here. And I thought the best way to describe it is I feel like I've been on a cattle drive in many ways. And so if you imagine that the cattle is data, what I'm trying to do is help move data and information from our old legacy systems and deliver it to you for your use in patient care, in research, and even operations day to day. And what we have along the way, if you can imagine a cattle drive, is we have rustlers trying to steal and take your cattle, right? We have to make sure the data is going in the right direction. And so the challenge before us is pretty significant. And I think with a cattle drive, there's a lot of dustiness. And that's one of the things I've noticed about living here in Fort Worth. It's a little dustier than up in New Hampshire. I want to highlight some important milestones that we've achieved. On this journey, we've essentially moved from Meditech to Epic. And like the term epic means, that's an epic move and really significant. And that really forms much of what we're going to talk about later in our core strategy. And very recently, we moved to Workday. We've essentially transformed all of our business and administrative applications to a new platform that's in the cloud. And at the same time, we've merged the research IT organizations with the business intelligence group within IS. And that's very significant because you're marrying the research informatics needs with the enterprise data and technology. And then very recently, we've released our enterprise data platform on which all of the data that we'll be talking about comes together. So as an IT guy, I need to talk a little bit about technology. So much of what we're trying to do and behind the scenes is modernize our infrastructure. So if you imagine that what we have here are legacy systems on site. So these are Excel files hidden in your network shares. These are systems that we've acquired, Complion for regulatory affairs, Iris for IRB, et cetera. All of the data is siloed and on-premise. If there's a power outage, if there's a water leakage and destroys the equipment, your data is at risk. What we're trying to do is essentially move all of our systems into the cloud. The cloud is essentially data centers that are managed by large companies like Microsoft, Amazon, and Google. and they manage all of the risk, and they distribute the technology so that it's redundant. And what that allows us to do is shift our costs from building and managing on-premise infrastructure, which is insanely expensive, to ones in which it's up in the cloud. Most of your e-commerce, your banking, your purchasing is all cloud-based. This is no different. But we're also looking to achieve what is called digital transformation. So what we're trying to do is take the best technologies available in analytics platforms, trying to infuse AI into our environment, even increase mobility, access to data and information and devices that you carry with you. And we're also looking to go cloud native. So all of these transformation engines that we hope to bring in are going to change the way you use technology. It's going to change the way you treat your patients and perform research. And part of what I wanted to highlight, though, is that we have so many different interoperable systems that data and information is a lubricant that's needed to make all of the gears work together. But unfortunately today, we have many outdated systems. We have completely flogged the utility and usefulness of many of our systems, so they get rusty and they don't work very well together. What we're trying to become is a smooth operating machine in which a smaller number of gears in our systems are driving the forward momentum of our data and information. But really, what is it we're trying to achieve? So why do platform modernization? Why do any digital transformation? What we're trying to become is a learning healthcare system. And that's really important to understand, because in a learning healthcare system, it is a virtuous cycle of constantly using new data and new information and turn that into action. Turn that action into practice, new operations, etc. And what I want to highlight, again, is this theme of constant cycling. Information needs to be continuously moving, not in silos, not at rest, but constantly moving into your hands for action and decision making. But this is actually a very research-focused group, so I'll share a little bit about how the learning healthcare system model applies to research. So much of our work has been in care delivery and modernizing our platforms and trying to transform the way we deliver care. And all of that data is deposited into a data warehouse. We currently do that. We have a data warehouse where all of this data sits in, and working within Epic, we're delivering clinical decision support. And all of that continues to operate in a cycle where clinical work continues to inform operations, and operations informs clinical work. But now what we're trying to do is layer in the research lifecycle on top of that. So we want to collect data that's sometimes outside of the normal standard of care, and bring that data into our data warehouse. And then we want to perform state-of-the-art analytics on all of that data and information, and then use the knowledge gained from research to inform clinical care. And again, the cycle continues. But research itself produces a lot of information. And I may have shared some of this with you last year, but I want to highlight it this year because we're undergoing a major transformation of how research operates here at Cook Children's. So generally speaking, in a research life cycle, you have ideas. These ideas are generated by yourself. You're thinking of, in the course of your treatment of patients or in your own research, you come up with a novel hypothesis you want to test. Other times, sponsors will come to you and say, hey, we've got a great idea. You've got the patients. Let's come together. And then we need to bring that into our environment and go through a cycling of processing those ideas and turning them into essentially research studies. And during the course of each of these steps, there are information elements that are created and then more that are consumed and used to better inform the institution as to whether or not we want to pursue this study, et cetera. And in addition, as we start to collaborate more externally with UTA, Texas A&M, and beyond, we now need to start bringing in external information. And then once a concept is agreed to and we decide to award that study within Cook, there's a whole slew of activities that are underway, a lot of information. Most of our historical research activities have been heroically put together in Excel files, REDCap applications, and we have a number of dedicated systems for regulatory compliance, IRB, et cetera. But that information really doesn't talk to each other. So you can imagine, if you're thinking about the gears, it moves a lot slower than we want. And there are friction points that bind the system when trying to use data and information. So what we're trying to do is modernize our platforms to make this cycling easier. We hope to make publishing and sharing of data and information easier. We're trying to essentially close out these studies. So yes, we can start them up, but let's finish them and complete them. And all of this is a complex dance of information flowing back and forth. There's behind the scenes challenges of ensuring that you have the right to use information, that the information is securely processed, et cetera. So that has been the biggest challenge for us. But we have a plan. And last year I introduced some of these plans, and I want to update where we've been over the past year. So I mentioned earlier that what we have here is a whole series of siloed systems, and we have major gaps in our portfolio. And essentially, if you've gone around the RAO office and IS, you do have many people working feverishly to push information back and forth. And over the past year, we've been implementing changes to our environment. So we've licensed a product called Cayuse ERA, and we've undergone the implementation steps for that. We're now starting to transform our life cycle. We're using terminology we've never used before, and we're very excited about it. And so the idea is that teams can work more collaboratively together and essentially identify projects, execute, et cetera. And then what we expect in the next year or two is to fill in the gaps of functionality with a new clinical trial management system. Since our strategy tends to be Epic-centered, we're looking to be one of the early adopters of Epic's vision of a clinical trial management system. Thanks to Dr. Stegall for promoting and pushing this interest. Epic is seriously considering us and are coming on site to show and tell what their clinical trial management system strategy will be. But we're also ambitious and anticipate growing our clinical trial portfolio, and therefore we'll be using an enterprise class system in the future. So what we imagine is a totally new type of work environment in which we're interacting with researchers all across the country, potentially globally, and being able to share our information in real time and participate in studies we never previously thought we could. So that's sort of our big ambition. So how are we going to get there? What are we going to do? And I want to spend a little bit of time on this because it will essentially make more sense when you see what I'll show you a little bit later. So much of our time has been built in modernizing our platforms that we use every day for patient care, for running the healthcare system, and et cetera. So all of these systems are producing data. All of this data, when it's in its natural cloud configuration, is available to us. We can actually put this data into our enterprise data platform and begin to link it up together for your use. We're putting together appropriate data governance practice to make it easier and faster for us to deliver information. And we're creating secure enclaves so that you can begin the process of analyzing the data. For those who are a little more nerdish on the technology, we're using what are called FHIR interfaces to essentially rapidly pull data out of Epic and into our workspaces. And then this will allow you to essentially analyze data using your own tools. And because we also participate in many collaborations, what we're proposing to do, and will be part of our roadmap, is build standardized data models. OMUP is an example, but I2B2 and others, so that it becomes simpler for us to share information in other external collaborations. So other organizations maybe that aren't Epic customers. And all of that will be available to us in our new computing environment. And by the way, at any point, feel free to stop me. I just love what we're doing here, and I get all excited about the technology, and I'll slow down and explain it in more detail. So in more detailed view, how we are achieving this is to use Microsoft's environment. So we're a Microsoft shop. Epic has partnered with Microsoft, so fundamentally it's to our advantage to leverage Microsoft as our strategic partner, and that's what we've done. So now we're using what is called OneLake. If some of you have your own private license to Microsoft, you probably have your own OneDrive, et cetera. Conceptually, it's the same thing. It's this massive data store, and we can push our data into that lake and then begin to prepare it for your use. A lot of data comes in its raw format, and we're going to call that the bronze tier of access. Some of you may want access to less clean data. But we'll also have very high quality massaged information at the gold layer, and many of you will be using that data. And then we'll also be creating a diamond tier, which is you tell us what you're interested in and how you want to use the data, and we'll package it for you in a workspace. And what's really exciting to me as a former scientist is I now can bring my own tools to the table and bring my own technology. And in my secure enclaves, I can use open source technologies. Our environment, if you're familiar with statistical analysis, excuse me, and many of the more commercially available tools. And then more importantly, out of compliance, because that's the other side of the equation we need to balance, is we now have technology that allows us to manage and monitor how well we are securing and using our data and information. So this is very exciting. I've talked a lot about technology and the platforms. Imagine, if you will, when I switched to this slide, you started hearing in the background the theme music to Star Trek. Dun, 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 right? You know that. Because we've essentially taken our BI team and we began essentially to transform what they deliver services. So in a traditional healthcare system, the BI teams are very focused on delivering reports. What we're now imagining is a new mission, and we've divided our teams into two distinct groups. One that I announced last year when I last met all of you for the first time is the Analytics Institute. So this group will be very focused on becoming your consultative partner. They're the groups that you can reach out to and essentially in a front porch-like experience get access to expertise. They'll guide you to what kinds of tools and technology to use. And more importantly, we're imagining building workshops and drop-in sessions to really promote the access and use of many of our new modern tools. But we're also needing to run the business. So we really need to deliver data and information to all of our operations, all of the patient care departments, et cetera. And so we plan to automate and infuse AI in how we deliver many of our reports. So this group is highly focused on delivering data. They're the essentially cattle wranglers or data wranglers that are going to keep delivering information. But we're not stopping, so we're going to continuously transform. So what we're trying to do now is develop what is called an honest data brokerage service. So many times people want access to data, and it's not always clear whether or not that giving that bit of data or information or access to the report is an appropriate one. So the honest data brokers are going to be an intermediate step in being able to give you access to data and information in a desensitized way such that you can begin to explore, is this the right data set that I have? Do I need more? How might I use it in different ways? And then this group essentially will partner with our clinical informaticists to expand the reach of our honest brokerage service. And so it will become less tedious or worrisome for all of you in accessing data and information because there will be someone here to guide you through that. We're also looking to expand the reporting options, and I'll show you some examples shortly within the Epic environment. So Epic is essentially determined to own the world of the EHR, and they're doing a darn good job of it. And so we're learning what they have in their roadmap, and they are delivering some pretty nifty technology. I'm not a salesperson on Epic, but when they're doing a good job, let's acknowledge that and base all of our strategy around that. So what we're trying to do is imagine, could we create our own instance of Cosmos, a little mini version of Cosmos? And I'll talk about Cosmos in a minute, but it's a de-identified version of our EHR in real time. So it decreases the regulatory hurdles to overcome in accessing that data and information. And so we're really excited about that. We're also trying to put together a SWAT team. So as certain analytic challenges come up or reporting challenges, do we have the bench strength to be able to rapidly assemble a team and meet those needs and try to deliver information in a matter of hours to days, as opposed to our current process, which is a ticket, it gets vetted and bounced around and eventually delivered. And as all of you know, artificial intelligence and machine learning are the buzzwords everyone is using in all of their systems, but we're no different. We have plans to make it easier for you to summarize your data, your information, et cetera. And much of that effort that we have is targeted towards research use cases. So we're very excited to be working with all of you to deliver AI and machine learning. There's some more mundane things we have to do. So right now, whenever you're looking to receive services from our organization, it comes at a competition with other groups and other departments. And generally speaking, keeping the lights on and running the organization typically gets higher priority than other needs. So what we're trying to do is create some capacity through a service center model that's very academic model, in which these resources are constantly available to each of you, either through extramural funding or internal funding, to be able to allocate those resources. And what that will do is remove some of that internal competition between different use cases of data. And then many people ask, what are you all doing? How often? And we are going to formally start developing an annual report. We're going to show how data is consumed and used across the entire institution and provide graphics. So when I came today to the symposium, I saw that nice brochure that described all of the research activity. Imagine something comparable from the Analytics Institute next year. So this is the exciting part. So what do we got today? Well, we talked a little bit about Cayuse. So Cayuse is a platform. It's a very traditional research administration platform. It's not a clinical trial management system. We had a few of those little misunderstandings along the way, but it's essentially helping manage the pre-award activities of research when you're formulating your ideas, your proposals, getting approvals, to the post-award, the publishing and closing of studies, et cetera. And what it will do is essentially enable us to have a real-time view of research activity in a dashboard fashion of our research demand, where we're at across the research life cycle, et cetera. And this platform will not only be useful for the RAO, but could serve as a platform for nursing research. We're speaking with Julia right now about bringing in research, and it will give us a truly global view of research activity. Interestingly, as we expand our collaborations externally, it now makes it easier for us to work together on grant opportunities, et cetera. So I'm very excited about that. And it will deliver one of the unmet checkbox items that Dr. Segal has asked for, is the darn dashboard. Show me the darn dashboard. And I think he said it a little differently, but we also implemented Calibra. This is a product that manages our data catalog. It's essentially, we're producing data assets, and there's a lot of jargon that probably isn't of interest, but information has a quality element to it, and it's derived, or it has lineage from other data sources. And what this will do is essentially collapse all of that information into a Google-like experience for you. What that means is if you're looking for a length of stay measure, or you're looking for any other measure, you now can use a simple Google-like query. You can submit a natural language. What are the length of stay measures at Cook Children? And it will give you the list. And what it will do is allow you also to explore how each of those different measures were derived. and a measure of goodness. And that's going to be really important, because if we're going to be providing you with much more data and information, we want you to trust it. We want you to understand it. We want you to do good things with the data, create more good quality data, and this will be an important platform for you in the future. We talked a lot about Epic and its evolution. We're now maturing our electronic data capture capabilities in Epic. We now have Cosmos released, and I'm going to go through all the fun slide presentations, but we're really expanding the breadth and depth of tools available to you from Epic. We have an actual release of Fabric. Microsoft Fabric is the name of the analytical environment that all of you will be working from. Members from the RAO have participated in our pilot, as had Quality and others, and this will be our data lake. And just a couple days ago, we officially launched our ResNet environment. It's a secured computing environment that's used by Dr. Papadelis' group and is a first stage in advancing high-performance computing in our environment. So I wanted to just give you some real-world views of what we're providing. So in this particular case, one of our star ninjas, Rena has shared, is building what we call our research functionality catalog. All of these tools and technologies available to you from Epic. And here we've migrated to electronic informed consent. This is a huge step forward, because traditionally it was paper-based. And again, we're wrangling, literally working hard to get the Epic's functionality to work in a very user-friendly way in our environment. And because all of our data and information is part of Epic, we can build special OPAs or BPA triggers to guide decision-making and actions you need to take. And a lot of these are being built to support the research programs that we have. So in precision medicine, we've already had phenomenal impact on being able to build many of these OPAs to help physicians know which drugs to give, et cetera. We're also focused on recruitment, and we're going to use MyChart more extensively to perform recruitment. Now, one of the things I didn't mention was Epic expects customers to be able to implement much of their features and functionality. And as a result, they give what are called gold stars. And these gold stars translate into real economic value to us, because we now get discounted rates in using Epic. So it's sort of like a reinforcing circle. And I just wanted to highlight that our research informatics team has achieved 10 gold stars, the maximum level for implementing our genomics module. And that's a testament to how a small, lightweight team has been able to hit way above their weight class. And I'm excited and proud of them. And then we're able to build forms to allow you to capture data. Here's an example of a patient-reported outcomes form that we can build. And this is very different than a more traditional approach where you're using third-party tools like REDCap and others. This is data that's collected during the patient encounter and is immediately associated with the patient record. And that promotes even more analytics and easier analytics later on. Here's another example of a data capture form being developed. So it's not so dissimilar to many of the tools like REDCap, Qualtrics, and others that have been built. There's a little more rigor involved in creating these smart forms, and even though it may take more effort, you get the payback later on because the data is in a form that we can use our reporting tools on. Speaking of the reporting tools, we now have an updated data hub for you where many of the reporting that you want or need are available, and these are available online if you have permission excuse me, to view them. You'll be able to see them, and in our new environment, we can customize how this report looks to you. The Analytics Institute is very responsive to being able to modify these. I mentioned these workspaces. These are secure enclaves, and if any of you are very familiar with the Python scripting language and the use of what is called a Jupyter Notebook experience, this is your new data science tool. This is very powerful and will allow you to perform analytics in a way you've never been able to do. And these are examples of quality, essentially, using this new environment. And because of the open source nature of it, we can bring in many other visualization technologies. So here we're able to use mapping technologies on top of it, and we can continue. I'm being given the keep moving sign. And here's an example of building data pipelines in our Fabric workspace. And again, all of this is secure. You don't need to install fancy software or other tools in your environment. Essentially, you just need to be granted rights to that environment. And this is an example, and we can continue through this. We're very excited to build out new types of analytics to support your research. All of our Power BI infrastructures on premise. It's now being migrated into our Fabric environment, and the ability to view massively large data sets is really exciting to us. And the reason that's important is as more and more data is being pushed out to the cloud, for example, like in Cosmos, you need the power of the cloud to be able to compute and read all of that data. About a year ago, I announced to the group that we're using Cosmos. We currently have 7 super users. What that means is we now can allocate 70 licenses to people to use and access Cosmos. Cosmos is up to about 2 billion patient encounters. So as you're exploring and mining, it's an exciting tool set. The demographics match the United States. And what we've also uncovered is we have look-alike functionality that's already released. So if you're working with patients who have a rare disease, you now have the ability to quickly compare your data with data from across the country. And there are instances that Epic has pointed out where a single patient was able to be matched across the country for the physicians to collaborate together. So this is really exciting. These are tools we're bringing to you. We are also very excited about our new research network. We call it ResNet. What it allows us to do is segregate a lot of the research activity away from the main clinic activity, which means we can do more. We can bring more tools to the table, et cetera. And in this particular case, the ResNet environment is essentially a Linux workstation. It has open source tools on it, and it's used by the Papadella lab. And more excitingly is it allows us to essentially have the same experience no matter where we're at. So if you're at UTA or you're here, you get your data, it persists. You have the ability to compute. So we're really excited about this, and we'll be continuously expanding our capabilities for you in the future. So in closing on this journey, I wanted to thank some key players here. My boss, Teresa Meadows, our CIO, and my colleagues on the IS executive team. I'm constantly asking them to do things they're just uncomfortable with, but they support us, and I'm very excited about that. Without their support, none of this cattle drive would be possible. And I wanted to say thank you, particularly to the research informatics team, Kim, James, Rena, I see you over there, and Chris and Long. They're not just cowboys, they're cowboy ninjas. I mean, they do great work, and I'm super proud of them. Melina, who leads the Analytics Institute, and Brad, who's leading the research and data platform. He's the reality team guy, so he has to deliver all of the platforms. Melina delivers all of the analytics, and research informatics is the glue that sticks everyone together. But I also need to thank Dr. Stegall and the entire RAO, because they are being subjected to not only platform modernization, but they're transforming everything they're doing, and they're doing that with humor and collaboration and partnership. So thank you all. Any questions?
No, Wayne. What took so long? I'm sorry. No, I'm just joking. This is fantastic. How many people have sat and tried to continue to update databases time and time again. Oh, where did we leave off? We left off at 2014. Now I've got to add all these patients in from 2015. And to have the ability for this to seamlessly move in is going to save so much time, and I think make us, as a clinician, it should help move projects forward, even possibly when we don't have those dedicated to help us move projects forward. So I'm very impressed by this. I did have to take some snapshots so that I can learn the language, because this is way outside of my field. But I'm really excited about having Cosmos up, hopefully soon. You think it'll be ready by summer?
Cosmos is available now.
Right now. So we're good, and I know we have people training on it.
We have people actively training on it, actively using it. So we have many openings. I don't know how many of the 70 are used, but we got plenty of room for.
This is fantastic. I think about this in our PRP program, especially using this to help students move through and do bigger things. So message is just thank you, because I'm really, and your team, because I think this is going to really benefit what people, even without dedicated endowed chairs, can do and accomplish within the framework of CCMC.
Thank you. Thank you for those kind words. I have to give credit to my boss. When I was recruited to Cook Children's, my focus was initially just research informatics. And then I said, I need all of this, all of the data. And it wasn't too long where she said, okay, then you drive both. And it's very unique in the healthcare industry to have research informatics and the data organization one. And the other factor is I've got this phenomenal team of research informaticists like Rena and others who just love helping and supporting research, and they just make stuff happen. So.
Hey, George, this is fantastic. Will you talk a bit about what are the plans for closeout? So you talk about the research life cycle. This has actually hit us a couple of times in the last, honestly, in the last couple of weeks, but a couple of months. I think we do a pretty good job of opening. I think we do a really good job of managing, and then we're doing so much work, we're not really closing out. Once the research is closed here, we sort of stop following it, right? So will you talk about the importance of the repository, the importance of the publication cycle, the importance of the closeout, and what are the plans?
Yep. So the platform we're using, Cayuse, has since you've been involved in the project, you know about the proposal development side. We're moving into the award stage. There is a post-award phase and a series of workflows that will be triggered. And then it will be very similar to the proposal stage in that there'll be notifications. You need to do this. You need to close out. Data's pulled out of Workday and into the environment. You build your reports that are needed by the sponsors, et cetera. So a lot of that will be baked in to the closeout phase of the study.
So current state is it's very reactionary, right? We ask people what they've done. We can do PubMed searches for publications. We're on the notorious EEG's Twitter feed and Papadilos's LinkedIn. So we hear about them. What for the user, for Dr. Perry, how is his experience in keeping track of publications and the closeout going to be different?
Yep. So in our first phase, we're probably not going to add the publication functionality, but you can imagine in the proposal stage, you list your planned presentations, et cetera, and those plans end up being carried over into the closeout stage. So when we said, oh, did you publish, in Nature, did you do the publication, there'll be that closeout step, so what you propose or not. But you can also add, so there'll be a step in the closeout where I did 5 presentations or I did, et cetera. Those get added and they get built into our database. As we imagine in the next few years building out something like a Catalyst profiles, the Catalyst profiles will essentially pull from that data. So we know from these studies, these 4 or 5 publication grade activities were pulled out, et cetera. So I think it's to be determined, but it will be done in a very agile way. We're going to show and tell a lot of how that workflow works together.
I'm all in for Epic. As you say, you said Epic wants to do all things EHR. Epic wants to own everything.
Yeah.
And I think that's a really good thing. For research, if Epic owned research, things get so much easier, right? And so the size and scale of Cook, just to give you that, is, once we told Epic what we were up to, they were interested in talking to us about a CTMS,
Yep.
right? And so we told them, if you had a CTMS, it would make our world a lot easier. And so now we're engaging in these discussions. How do we maintain our status as an Epic user and not an Epic site? The data goes up to the cloud. The cloud really is an Amazon server on Epic's farm, right? So how do we maintain control over our own data?
So Epic's strategy for cloud services is called Nebula. And what they do is virtualize our on-premise infrastructure in the cloud.
Okay.
So it is a Cook instance that's up in the cloud, and then it uses the Fabric technology to link data together, et cetera. But getting back to Epic wanting to own the world, I'm also a long-time academic guy, and I love Google and the Google platforms as well as Amazon. So on our roadmap, we are planning a landing zone for using these technologies, because as you can imagine, as they approach a monopoly state, they will drive a large portion of our costs. So Epic is expensive enough, and so one way to keep them honest is essentially have a backdoor way to use their data and information to keep them humble. So we do have that.
Excellent.
And then some of the AI technology that Google is promoting for healthcare, I think, is far above what Microsoft has done so far.
This isn't a question, more of a self-plug. Dr. Lanier, Cosmos is coming to PRP this summer. We have 5 projects dedicated to Cosmos this year. If anybody in the room has an idea for a Cosmos project that a PRP student would love to do this summer, contact me and I'll get you set up with that.
All right, well, keep us on time. Thank you, George. This is great.
Thank you, everyone.